Welcome to Pixarize's scene for vitamin B9 deficiency and vitamin B12 deficiency, part of our series on the vitamins. This is going to be a 2-for-1 since there's a lot of overlap between the two deficiencies. It takes place in a natural history museum with a particularly eclectic set of exhibits. If real museums were this bizarre, maybe museum attendance wouldn't be falling in this country. In any case, let's take it all in. We're going to start in the center of the image. As is often the case here at Pixarize, we've placed the elements common to both of our diseases in the center, and the elements unique to B9 or B12 deficiency on the two sides, kind of like a big Venn diagram. The first thing that probably caught your eye here is that huge megalodon statue. We personally find the fake blood on its teeth a little much, but I suppose it's accurately conveying that the megalodon was a fearsome, bloodthirsty predator. Still, he might want to see a megalodontist. But, Chang. Yeah. Anyway, the bloody teeth are helpful for us, since the megalodon represents megaloblastic anemia, the most important side effect of both B12 and B9 deficiencies. Megalodon, megaloblastic. Bloodthirsty shark, bloodthirsty body. Makes a lot of sense. Megaloblastic anemias are macrocytic anemias caused by folate and B12 deficiencies. We mentioned in our scenes for vitamin B9 and vitamin B12 biochemistry that both vitamins act as cofactors in DNA synthesis. When red blood cells can't synthesize and replicate their DNA, they can't divide, and the result is a macrocytic anemia characterized by fewer but larger red blood cells. Now, check out our modern Michelangelo painting his piece de resistance. We'll get to his masterpiece in a bit. For the time being, we're going to focus on this painter's fall net. The piece he's working on has a lot of blue in it, so he needs to keep a ton of blue paint on deck. This crafty guy stores all of his blue paint cans in this pink netting. He also takes naps in it when he gets bored, but don't tell the museum donors paying his contract. If you've got an artistic eye, you'll notice that the cellular-seeming hammock with lobe-looking paint cans looks a lot like a polymorphonuclear cell, or a neutrophil. That's to remind us of hypersegmented neutrophils on peripheral blood smear, one of the earliest and most sensitive signs of a megaloblastic anemia. Usually, the nuclei of neutrophils contain 2 to 5 lobes, but impaired granulocytic precursor division in megaloblastic anemia leads to the production of neutrophils with greater than 5 lobes. Wacky, huh? Alright, now we can feast our eyes on Michelangelo 2.0's masterpiece, Hommage à Homer. That's right, his magnum opus is a Sistine Chapel-style depiction of one of the most important cultural figures of our time. This Homer Sistine Chapel painting should help us remember homocysteine. That's right, Homer Sistine. And since the painting is on the ceiling of the museum, we should be able to recall that homocysteine levels are elevated in the setting of either B9 or B12 deficiency. Lastly, notice that our Homer is sticking out his big red tongue. This is our recurring symbol for glossitis, the last clinical feature seen in both B9 and B12 deficiencies. Next, we'll cover the features of a specific deficiency in vitamin B9 or folate. Direct your attention to the left side of the image. Remember our folate fol from the B9 biochem image? She's back. Well, different fol, but same idea. The fol in this little petting zoo area will remind us that this side of the scene covers folate deficiency. Now, let's zoom in a little closer on our fol's midsection. She's looking plump. I think she's part of a breeding program between a network of museums that all have petting zoo exhibits and need to stock up on baby foals. Our pregnant foal mom is here to remind us that folate deficiency is common in pregnancy, which is actually a big problem. Take a look at her bulging belly. See that tube dumping water into her drinking pool underneath? This water tube represents the neural tube defects, which include spina bifida and anencephaly, that occur in children born to folate-deficient mothers. To avoid these catastrophic outcomes, mothers are advised to take folate supplements at least 1 month prior to conception and during the early stages of pregnancy. Moving on, let's shift our attention to the pool being filled by our neural tube defect water tube. This small pool of water has an interesting shape, doesn't it? Yeah, it looks like a liver. There's your artistic eye again. The body's folate stores are located in the liver, and it's a small pool of folate compared to the much larger pools of vitamin B12 in the liver, which is why we've made the drinking pool so small in this image. Folate deficiency is actually the most common vitamin deficiency in the United States. Its small storage pool means it's often the first vitamin to be depleted. Again, that's why the liver pool is so small here. It wasn't to represent animal cruelty or poor treatment by museum operators, though, I don't know, that's probably a thing. And see those empty bottles floating around the little liver pool? These are empty alcohol bottles, intended to remind us that B9 deficiency is often seen in alcoholics. They're not here to make a statement on the behavior of museum patrons who throw trash into petting zoos, though, I don't know, that's probably a thing too since we live in a deeply disappointing society. Before we move on, I want to reiterate that this small reserve pool is really high yield. Question stems will describe a malnourished patient who presents with a megaloblastic anemia, usually an alcoholic. Then they'll ask you which vitamin is most likely depleted, either B9 or B12. Well, the answer is B9, and it's because of this small reserve pool. Okay, we're ready to shift over to the right side of the image and get to talking about vitamin B12 or cobalamin deficiency. But for this, we'll need to head over to the physical science portion of the museum. First, check out this old grandfather clock in the bottom right corner. Do you recognize that design? Yeah, this piece is from the same line as our little alarm clock from the cobalamin biochemistry scene. Who knew it was an antique? Just as it was in that scene, this is a B clock pointing at the number 12 to represent vitamin B12, and it's that same shade of cobalt blue that helped us remember B12's other name, cobalamin. The rest of this grandfather cobalt clock is very different from our little alarm clock though, and we'll touch on its differences in a little bit. For now, I just want you to take a look at the frayed wire plugging the clock in. Notice how the wire to the clock is frayed? This is our recurring symbol for paresthesias, and it should remind you of the neurological problems associated with B12 deficiency. Specifically, B12 deficient patients get subacute combined degeneration due to the loss of myelin, but again, we'll cover this more later. It's important to note that these paresthesias are frequently included in questions about B12 deficiency, since it's a good way to differentiate it from folate deficiency. So be on the lookout for a patient presenting with sensory deficits in addition to those symptoms of megaloblastic anemia. Next, check out the awesome metal Millennium Falcon replica hanging above the museum floor. It's totally true to its cinematic inspiration. You might remember from our vitamin B12 biochemistry video that B12 is a required cofactor in the reaction catalyzed by methylmalonyl-CoA mutase. There, it was represented by the metal Millennium Falcon, since metal millennium sounds like methylmalonyl. Metal millennium, methylmalonyl. Nice. Well, here it is once more to remind you that without B12, levels of serum methylmalonic acid will rise. This is incredibly high yield, and it's one of the main ways to distinguish vitamin B12 deficiency from vitamin B9 deficiency. In B12 deficiency, methylmalonyl levels are high, but in B9 deficiency, they're normal. Seriously, just remember this and you'll get most vitamin B12 and B9 questions correct. And that's it for vitamin B9 and B12 deficiency. These are two commonly tested vitamin deficiencies, and the question stems almost always force you to choose between one or the other. Patients will present with hypersegmented neutrophils and a macrocytic anemia, which will tip you off to a megaloblastic anemia. They may even give you the elevated homocysteine levels, and since you know it's megaloblastic, remember our megalodon to recall the rest of this image. You'll then be asked either which vitamin gets depleted first, or what the level of methylmalonyl-CoA is. For the former, we know our folate full drinks out of a small liver reserve pool, so folate goes before B12. For the latter, we know that the metal Millennium Falcon is elevated over in the physical science portion of the museum. This is where our B12 o'clock clock is, so B12 deficiency must have elevated methylmalonyl-CoA. Okay, so I was joking about this image being finished, I mean, hey, B9 and B12 deficiencies are complicated. But luckily for you, what we've already covered is going to get you most of these questions right on test day. Seriously, it would be totally reasonable for you to stop the video and move on. This is all the high yield stuff. That being said, if you're gunning for a really high score, and there's no shame in that, there's more you'll want to know. Let's return to the folate side of the image to talk about some of the drug-induced causes of folate deficiency. First, if we look below our small liver pool, we can see a huge footprint. Since this is a museum, I can't tell if that footprint is real or just a replica print from some prehistoric creature. Come to think of it, I can't even tell if that pregnant foal is real or just some really messed up taxidermy thing. I am confused and afraid. Anyway, the big toes in this big footprint should help us recall the anti-epileptic drug phenytoin. We're really putting the toe in phenytoin, huh? Big toe phenytoin can induce a whole host of side effects that you'll learn in your neuro module, but the side effect to remember here is folate deficiency. Next, look to the left of the folate foal at that bunch of sulfurous, rotten eggs. How are eggs an exhibit? Are they being fed to the foal? Does the foal eat eggs? Does it eat at all? Do pregnant foals lay eggs? Is it real? I'm really starting to lose it. Well, these sulfurous eggs should at least help us remember that sulfonamides, like sulfa antibiotics, are common vitamin B9 deficiency inducers. Finally, check out that sick projection over the folate foal exhibit. They must have been showing an informational video on foals, but something's clearly not working. Wait. It's the Matrix. I was having enough trouble questioning if the foal was real or not, and now I have to question whether my own life is real or a simulation. I hate this. I'm going to try to keep this conversation about board prep. A painful reality, but a reality all the same. See, this matrix on the wall is there to represent methotrexate, which is often abbreviated as MTX. MTX for methotrexate, MTX for matrix. Matrix methotrexate is a cancer-treating antimetabolite that can also induce a folate deficiency. Now, back to our cobalamin clock. First, check out that tacky decorative quartz lining the sides of the clock. Isn't the quartz usually inside the clock? Whatever. I mean, it is a science museum. Maybe these new designs work better or something. This quartz on the lateral surfaces of the clock represent the lateral corticospinal tract, or the lateral corticospinal tract. Got it? Lateral quartz for lateral corticospinal. And if we look inside the grandfather clock, we can see it has an interestingly shaped pendulum. You may remember this symbol from our scene for vitamin E. That's right, the bell-shaped pendulum swinging from the bottom of that spine-shaped arm is our recurring symbol for the spinocerebellar tract. It's our spinocerebellar spine bell. And finally, behind the spine bell spinocerebellar tract is another recurring symbol, ancient columns, which represent the dorsal columns. And notice how they're located dorsally here. Perfect. These three tracts in the spine, the lateral quartz lateral corticospinal tract, the spine bell spinocerebellar tract, and the ancient column dorsal column, are all damaged in B12 deficiency, a phenomenon collectively known as subacute combined degeneration. This process, which occurs as the result of abnormal myelination, results in an ataxic gait, impaired position and vibration sense, and paresthesias. Basically anything that these tracts normally do can go wrong. Remember our paresthesia wire from earlier? That's why it's here. Now we'll knock out the various causes of a vitamin B12 deficiency, since there are actually quite a few. Let's head over to that spruce tree where it looks like a museum staff member is having some trouble corralling a few loose birds from the aviary exhibit. Let's start with our angry staff guy's hair. He and his disco curls are here to nab that parrot and teach us about pernicious anemia. His wacky 80s perm is going to be our symbol for pernicious anemia. Get it? Like pernicious anemia? A pernicious anemia is a megaloblastic B12 deficiency anemia that's caused by a lack of intrinsic factor. Recall from our B12 biochemistry sketch that intrinsic factor is a glycoprotein secreted by parietal cells in the stomach that binds B12 and allows for its absorption in the terminal ileum. Since you need intrinsic factor to absorb B12, it makes sense that without it you'll end up with a B12 deficient pernicious anemia. And look at that sweet bird he's after. That parrot bears a striking resemblance to the parrot from our cobalamin scene. Go figure. Once again, this parrot is here to represent parietal cells, which secrete intrinsic factor. Now, check out our perm guy's pincers. That contraption he's using to catch our parietal parrot looks menacing, and like an antibody. This represents one of the most common causes of pernicious anemia, autoantibodies to parietal cells. Since parietal cells produce intrinsic factor, no parietal cells means no intrinsic factor, and no intrinsic factor means no absorption of vitamin B12. That's actually the definition of pernicious anemia, anemia secondary to lack of intrinsic factor. Similarly, antibodies to intrinsic factor itself can cause pernicious anemia. So how else can we lose intrinsic factor? How about surgical removal, like gastric bypass? In gastric bypass, the parietal cells are surgically removed from the stomach, leading to a loss of parietal cells. See the little bag on the end of our pernicious pincers? It kind of looks like a stomach, doesn't it? This should help you remember that gastric bypass surgery can also remove parietal cells, leading to a lack of intrinsic factor and subsequent pernicious anemia. So, when thinking about pernicious anemias and the autoimmune destruction of parietal cells, just remember our guy's prodigious perm and predacious parrot pinching, and your step 1 prospects will start to feel propitious. Perfect. Now let's talk about other causes of B12 deficiency. Another common cause of B12 deficiency is malabsorption in the terminal ileum, where B12 and its complex intrinsic factor are absorbed. Well, take a closer look at this tree. Is that a pine? Nah, that's a spruce tree. This spruce tree is our symbol for celiac sprue, or celiac spruce, a condition that can cause malabsorption and predispose to B12 deficiency. Sorry, I just get juiced from saying spruce. Anyway, we can see that a black crow has alighted on our spruce tree. This crow represents Crohn's disease, which often affects the terminal ileum where B12 is absorbed. And notice that our crow is on that terminal branch. Terminal branch for terminal ileum. Also notice that the terminal branch is breaking. That's right. In addition to malabsorption, Crohn's patients may also have a resection of the terminal ileum performed, in turn causing a B12 deficiency. Really, anything you can think of impairing the absorptive capacity of the terminal ileum will cause B12 deficiency, including its resection. And speaking of absorptive, check out that absorptive toilet paper worming its way from the bathroom doors to our spruce tree. Alright, I'm done, I promise. I'm just making sure you're awake. The toilet paper is worming its way over because this bathroom TP is there to remind us of Diphyllobothrium infection, or Diphyllobathroom infection. Diphyllobothrium is a tapeworm that looks a lot like these strands of toilet paper, and it can live in your gut and eat all your B12 before you can. That's gross. The final cause of B12 deficiency we'll cover is a simple lack of B12 in the diet. Under our spruce tree, you'll notice that there's like an eggplant, a cabbage, I think that's a squash. Whatever, it's a bunch of vegetables. Vegetables because veganism can cause B12 deficiency, since B12 mostly comes from meat. Remember our gross meatloaf from the cobalamin scene? Maybe you wanted to forget. And that is it. Finally, I promise this time. Give yourself a pat on the back. This scene was a Homer Sistine Chapel level undertaking, but you've made it through. And you didn't even need to hold your parents' or guardian's hand while you checked out that scary megaloblastic anemia megalodon exhibit. Seriously though, I'm impressed. We covered a lot of material here, and it took us way longer than 12 parsecs, so I would recommend going back over the image while it's still fresh. Megaloblastic anemia is a frequently tested topic since exam writers love when they can probe your ability to differentiate between two similarly presenting diseases. Good luck, and until next time.